provide the opportunity for people to get vaccinated. And I encourage everyone across Western Australia to take the opportunity to get vaccinated. It's what will save your life, save your family, save your community, prevent serious illness and prevent death. So just encourage everyone, please go and get vaccinated as soon as you possibly can. In terms of the across regional WA, we're opening 14 new pop-up clinics, and these are all walk-ins. These new pop-up clinics are being opened in Geraldton, Fitzroy Crossing, Newman, Karratha, Broome, Paraburdoo, Tom Price, Headland, Halls Creek, Wyndham, Kununurra, and more locations will come online in coming weeks. You can find all the details online, but those clinics are opening for people to get vaccinated all over regional WA. We really want to lift the rate of vaccination in regional WA. It is not as strong as in the city, and it's very important that people in the regions take the opportunity when the clinics are in town to go and get vaccinated. When it's there, use the opportunity. COVID is insidious. It can come into any community at any time. Please take the opportunity to go and get vaccinated. In terms of other issues, obviously there's been some issues in Tasmania. So I understand the Tasmanian government has engaged in a lockdown for part of Tasmania. It has a range of sites that are exposure sites. If any West Australian returning home from Tasmania has been at one of those 5 exposure sites, they're now required to quarantine and be tested for 14 days. So isolate and be tested, but they'll be required to stay in quarantine for 14 days and be subject to a number of tests. So any West Australian returning home from Tasmania is required to do that when they return to Western Australia. We'll monitor the situation. If we need to upgrade the advice, we will, depend upon what happens in Tasmania over coming days. So if you've been in Tasmania, you've been to the exposure sites, get tested and isolate for 14 days. Obviously there's a range of other issues, but I'll wait for your questions.
In terms of vaccination here, there's still been a little bit of not sure. People are asking, wanting food vouchers, wanting a payout. What's your advice to those that are hesitant?
Go and get vaccinated now. COVID can come in. It can take your life and your family's life. Don't wait. Don't hesitate. We haven't put in place incentives or anything like that. The biggest incentive is it can save your life and stop you getting seriously ill. So just go and get vaccinated now.
CBH is looking at giving $100 to their workers if they're double vaccinated. Your thoughts?
Oh, well, if private employers want to do that, I welcome that. But people shouldn't hold out getting vaccinated waiting for that. We just got to get people vaccinated. It's free. You can walk in and do it. It's safe and it makes you safer should we have an outbreak. We've been incredibly fortunate in Western Australia over the course of the last 2 years. We've had very, very few cases, minuscule number of cases. But you don't know what's around the corner. You don't know what could happen. So don't wait. Go and get vaccinated now.
You mentioned those Midwest and Geraldton vaccination rates. How does that compare to other regional centres in WA?
Well, it's better than some and not as good as others. Generally, the closer you are to Perth, the higher the vaccination rate is. The further you get away, the lower it is. But Geraldton is doing pretty well, to be honest, but we want to lift it. That's why we've got this clinic here available. You just walk in, takes you about 15 minutes, you get vaccinated, you're on your way.
Just on the snap lockdown in southern part of Tasmania, do we know how many people have come from Tasmania into WA in the last few days?
I don't have those figures to hand, but there has been a lot of West Australians go to Tasmania on holidays, so it has been one of the few places we can go. We can currently go to South Australia, Tasmania, Northern Territory and Queensland subject to some conditions, but I've known actually a lot of people go to Tasmania on holidays, but if they've been to the exposure sites, they come back, they're required to be tested and isolate for 14 days.
Just some questions from Seven. Premier, have you let down WA by not setting a date for reopening, given how lagging it's stuff?
No, what we're doing is getting people vaccinated each and every day. We're putting in place a whole range of ways for people to do it. For instance, these clinics in regional WA, we're mandating parts of the workforce and we're ensuring that we do our best to keep the virus out. You know, we're in a far better position than any other state in Australia and probably any other place in the world. Our vaccination rates climb each and every day. We do everything we can to get people vaccinated. Our outcomes have had the strongest health results and the strongest economic results of anywhere in the world. So West Australia's doing well. Next year we'll work out exactly, or we'll announce for next year exactly when the borders with New South Wales and Victoria will come down. But my overwhelming impression of people is they're happy to be COVID-free in WA, and that we don't want to be like New South Wales and Victoria. But the reality is we just have to get to a very high vaccination rate before we lift border controls, and that's our plan.
In light of some news earlier this morning, people are pretty furious that those in New South Wales can go to London but can't go and see their families in WA.
Who's furious?
Locals, people are furious that they can go to London but they can't come to WA.
Look, it's very unclear what exactly has happened in New South Wales, but it's obviously not in accordance with the national plan, what is going on over there, and it's a situation in which if someone comes into New South Wales now, obviously from overseas, obviously they'll be subject to the rules that apply to New South Wales, and those rules are that it's extreme risk. So we basically don't let anyone in from New South Wales at this point in time because it is an extreme risk jurisdiction. So if you return from overseas and you don't do 2 weeks of hotel quarantine in New South Wales, well then you're not going to be permitted to come back into Western Australia. That's the rule that applies to everyone from New South Wales. Look, I understand why the New South Wales government may be moving in this direction, because it's probably just as safe overseas as it is in New South Wales. But Western Australia is in a very different position. We don't have any COVID. We don't have any lockdowns. We don't have any restrictions. But if we get cases, obviously, then we'll have to put in place restrictions and rules and potentially lockdowns, and people get sick and some people will die. So we're very keen to keep our current condition until such time as we get extremely high levels of vaccination in place.
Hospitality and event businesses are expressing concern over what COVID restrictions returning when all borders reopen could mean for them. How will these businesses be supported?
Well, by having high levels of vaccination is the most important thing they can do, and having a community which has managed the situation very well. You know, I get arguments on the one hand, open borders, and then arguments when the borders are open, we don't like it, so it's hard to win. But once we get to very high levels of vaccination, when we do set a date for opening borders to New South Wales and Victoria, then we'll put in place measures which are called public health safety measures. Now, they can be low level at the start, they might climb over time depending upon the rate of infection. And that's to be determined based upon the circumstances that we face. But in terms of businesses, hospitality, retail, particularly regional tourism, it's never been so strong. And that's because we've had great COVID outcomes, and West Australians are spending money within our state more so than ever before. We now have the lowest unemployment rate in the nation by a long, long, long way. We have one of the lowest unemployment rates, the strongest economies in the world. Our plan is to continue that for as long as we can.
The AHA says if any capacity limits are placed on pubs or restaurants, some venues may be forced to close. How worried are you about that?
Well, this is a long way off. Hopefully it's a long way off. Sorry, I'll put it that way. Hopefully this is a long way off that we have to do this. In the meantime, all we want to do is get people vaccinated as much as possible in the lead up to opening borders internationally and interstate.
Do you think the New South Wales decision to open international borders will have an impact on how soon we reopen our WA border to New South Wales?
Yes, I do. Look, I'm not exactly sure. There's been a lot of I think, arguing between the federal government and the New South Wales government today. And that's obviously because whichever plan New South Wales is adopting is actually not in accordance with the nationally agreed plan. Because the nationally agreed plan was that if a state hits 80% 2-dose vaccination, it requires an average of all the states to hit that before any changes are made. And clearly New South Wales is not doing that. It's going alone. So whatever New South Wales is doing is outside the agreed national plan.
So how can they do that?
Well, because states are sovereign jurisdictions. And so I think the national plan is there for guidance rather than to be followed slavishly. And certainly if New South Wales is permitted to do this, we'll be flexible in our application of the national plan as well, because we are a COVID-free state and we don't necessarily want to have COVID come in before we have high levels of vaccination in place. But just back to your original question, what was it again?
Will it change how soon we reopen?
Yeah. Obviously, New South Wales doing this, I understand why they would, because you may well be just as safe overseas as you are in Sydney. But it may mean there's greater spread of the virus in New South Wales. So that would obviously mean that we would keep our current border arrangement, which is at extreme risk with New South Wales, in place for as long as is necessary. It's unfortunate. I myself, my parents, my brother live in New South Wales. I can't see them. But it's necessary to protect our state and keep us in the very good condition we're in.
When we get to a vaccination level above 80% and you set a date for the reopening, how difficult will that decision be to reintroduce restrictions?
Yeah, that's what we're working through at the moment. So what will happen is somewhere between 80 and 90%, we will set a date to reopen borders to New South Wales and Victoria. And that will mean people will have the final opportunity to go and get vaccinated. As we do that, then we'll have to have measures ready, which are called public health safety measures. It's sometimes distancing, it's rules about how many people can go to an event, how many people can go to a basketball game or a football game, perhaps restrictions in relation to hospitality venues. Some of those will be ready and they will be put in place dependent upon the situation we face. So if you have very little community spread of the virus, well, the measures put in place will be minimal. If we have higher levels of community spread of the virus, well, the measures put in place would obviously have to increase in order to protect the public as much as possible. So what National Cabinet has been briefed on numerous times is that when you have spread of the virus, there's three things you can do. One is vaccination, which we're doing. Two is very strong contact tracing, which we will have in place. And three is public health safety measures, and they are things like mask wearing, things like distancing inside venues, smaller capacities at football games and major events and those sorts of things. And that's to be worked out dependent upon the circumstances. So that's what's happened over the course of the last 2 years, and that's what we do if we have an outbreak.
Do you accept that WA is being left behind in regards to how we live with the virus?
No, I don't. These questions are obviously coming out of the east. The fact of the matter is that we don't have the virus in Western Australia. People in Sydney, some of the commentators, don't seem to understand that. There is no community spread of the virus in Western Australia, so we don't have any restrictions in place. Therefore, we could hold a grand final. The AFL grand final here was 61,000 people at it. Therefore, we have an extremely strong economy. The unemployment figures came down yesterday, 4.1%. I mean, other states are over 5%. And we have the highest participation rate in the country by a long, long way. We brought down our state budget. We're the only budget in surplus. All those things are because we've managed to eliminate the virus within Western Australia. But obviously at some point in time, when we bring down international and interstate borders, there will be some transmission of the virus in WA. Prior to that, we're just getting as many people vaccinated as we can, and we're getting ourselves ready for what measures need to be put in place when the virus arrives here.
What kind of COVID-related hospital pressure would there be in WA when we do open at 90% double-dosed vaccination?
Look, there'll be modelling around that. We'll release that in due course.
Are the regional hospitals prepared to handle an outbreak when we do eventually reopen?
We're very confident that our health system will be able to manage the situation when we reopen. Obviously, it's under a lot of pressure, but if you go to South Australia or Queensland or New South Wales, Victoria or Tasmania, the premiers there will say exactly the same thing. There's a lot of pressure on our health systems. A lot of that is delayed reaction to COVID. A lot of it is particularly at nights and on weekends, lack of access to GPs. We have the lowest per capita number of GPs in Western Australia of any of the states. So there's a range of factors behind that. But we are doing our best, and also we have a lot of staff who are absent sick, because if anyone's got a respiratory illness, we ask them to stay away. So it puts a lot of pressure on our hospital system. But we are very confident. We have measures and plans in place to deal with it should we get an outbreak in WA.
We've heard that the portable anteroom that was sent to the Geraldton Hospital back in July wasn't actually able to be used during that COVID-positive seafarer due to design issues with the emergency department. Is this acceptable for us as a regional hospital to be preparing for COVID with something that doesn't work?
Look, it was unfortunate, but we do our best in difficult circumstances. So The staff do their best. There were some issues there, but we do our best in difficult circumstances. Nothing has been perfect over the COVID period, but fortunately there wasn't an outbreak, there wasn't community spread of the virus, and the measures we put in place worked.
Has that issue been addressed now?
I understand it has been, or it is being. Yeah.
Will WA honour the quarantine requirements of other states that accept international travel as acceptable to then travel to WA?
No. So if New South Wales opens borders and allows people to come back without quarantining, that doesn't mean those people will be able to come into Western Australia. If they don't do 2 weeks hotel quarantine, when they come back from overseas, they won't be permitted into Western Australia. So the current arrangement is, if you come into New South Wales from overseas, you do 2 weeks in hotel quarantine. And then if you test negative, you're allowed to come to Western Australia. But if New South Wales gets rid of its hotel quarantine system, well then people returning to New South Wales who haven't done that hotel quarantining, they won't be permitted to come into WA.
Given our vaccination rates in WA, do you think that New South Wales' decision to restart international travel will put West Australians at risk?
No, because no more than currently, because we have a hard border with New South Wales. So it doesn't change the situation for us. I understand why New South Wales, as I've said a couple of times, would do it, because they have community spread of the virus, and you're probably just as safe in Britain as you are in Sydney. So it probably doesn't materially change the situation for them. But for us, without any cases, obviously we're not going to do anything like that until we have very, very high levels of vaccination in place, and we don't expect that will be till next year.
Is it time to prepare people for the reality that living with the virus will mean we will see deaths and hospitalisations regardless of how high the vaccination rate is?
Well, that is the reality of COVID. When you have community spread of the virus, it does cause health issues. But the good thing is we have bought ourselves time to get our population vaccinated and to keep people as safe as possible in the meantime, whilst we get to that very high level of vaccination. But that's why I'm standing here at a vaccination clinic today, encouraging everyone to get vaccinated. So I don't know what's around the corner. I don't know if tomorrow a seafarer or a truck driver or a flight crew or something might happen that might result in spread of the virus. So please go and get vaccinated now.
In light of that, a 24-year-old male was in court yesterday and pled guilty to 10 charges of failing to comply. He came from Queensland to Perth and then was in the community regional WA, Kalbarri, for a numerous amount of days. How selfish is that, and is that a wake-up call to WA?
Well, we've had a number of those cases. Those 2 blokes at the footy, this fellow. If you do the wrong thing in your court, you suffer a pretty severe penalty. So don't do the wrong thing.
And does the state government have a plan for booster shots at this point?
We'll work that through with National Cabinet as to when that rolls out. The main thing now is just for everyone to get vaccinated, your 2 doses up front. The booster shot program will largely focus on people who are unwell, immunocompromised, perhaps the elderly, but that's something that we'll agree nationally and that will roll out, I suspect, next year. Thank you.
Thanks,
Thank you.
Righty.
Oh my God, you must get strength in your arms.